For the simple reason, this chapter on homeostasis and adaptive responses occurs in all these patients that we handle, whether it is strokes, traumatic brain injury, whether it is going to be about MS, because why? Our body has the autonomic nervous system, right? So remember the word homeostasis, state of equilibrium or balance. So the definition is state in which all the symptoms are in balance or ideal set point. Okay? Whatever clinical condition you have to be able to explain this. Just like what we did for the signature assignment. When we're talking about how does it affect the other organs, right? Response. So these are response of the body that are usually designed to make you what? Survive and to cure or heal you. Okay? Now aldostasis, again, is a common word that we often use, is basically the response to survive, to make you survive. Addresses complexities and variable levels of activity necessary to maintain what? Or re-establish what? Homeostasis. I give you an example. A patient, when the patient is fed by the nurse and the food that he eats has sugar, what happens with the blood sugar levels? It goes up. What's a normal blood sugar level? 60, 200, 1500, 20, 126. It goes up to as high as what? 200 to 300. Okay? What will happen? What will happen to the pancreas? The pancreas will secrete what? Insulin, which going to what? Lower the blood sugar from what? 200 back to what? Maybe 110 or 100, right? And that is what we mean by the word homeostasis. What happens in diabetic patients? The beta cells of the pancreas do not produce insulin. Will you be able to lower the blood glucose levels? No. What happens to the blood glucose levels? High. It's called hyperglycemia. Does that make sense to you, right? In other words, you develop that kind of situation because there is something wrong with your beta cells of the islets of Langerhans of the pancreas. Okay? So you have to maintain a balance or equilibrium. Now, of course, in our body we have a lot of stress, whether it's physical, chemical, emotional. Now, remember the word flight or fright syndrome? It's called what? It's basically what you see in patients with the general adaptation syndrome. The general adaptation syndrome is designed to make sure that you survive. Example, if this building is on fire, guess what? What happens to your pupils? Dilate. Because what happens if there's a fire, the lights are turned off, you need to be able to see how your pupils dilate. What happens to your heart rate? It beats faster because you want to pump more blood where? To the leg muscles so that you can run away from the building, and then more blood to the brain so that you can think carefully. Why? So that you know where to go. You can see the sign that says what? Fire exit, follow the sign. Are we going to use the elevator or the stairs? The stairs, because you don't want to be trapped in the elevator. You can die from burns. Okay. So again, stage of persistent activity of the nervous and endocrine systems in returning the body to homeostasis. See, so this is the important thing to remember is that this involves a lot of organs, including what? The hypothalamus, the pituitary gland, and again it goes back to the study of anatomy. Remember, the hypothalamus is the master of the master gland, which happens to be the pituitary gland. So you involve the hormones from the hypothalamus. Remember CRH, what does CRH mean? Corticotropin releasing hormone. At the same time, it goes into the blood circulation to go to the pituitary gland. And what is ACTH? Adrenocorticotrophic hormone, which now is going to go to the blood, goes to the adrenal cortex, releasing all these hormones like your what? What's another name for mineralocorticoid? Aldosterone. What's another name for glucocorticoid? Cortisol. Very important. When your glucocorticoid level is high, what does it do to the blood glucose? High, elevated. Why? Glucocorticoid, cortisol, which is an example of a steroid. Okay, because in a flight or fright situation, you want to have high sugar levels so that you can what? Have the energy to survive. Okay, so this is the effect. Stressors. It affects the hypothalamus, then affects what? The pituitary gland, the anterior pituitary gland, otherwise known as adenohypophysis, and obviously it affects what? The ACTH affects your what? Adrenal gland. So again, you can see here the effects. Stress response to tissues of the body, gluconeogenesis, protein metabolism, so on and so forth. So make sure you study this slide. And of course, states of exhaustion. What does that mean? point where the body can no longer return to homeostasis. I'll give you an example. One of the chapters we talked about was what? Fluid volume deficit. What's the most common cause of fluid volume deficit involving the GI tract? Diarrhea. Okay, so when you have diarrhea, what happens? Okay, you have what? Excessive bowel movement, there's increased peristalsis, you lose a lot of water in the stool. So what happens? You have fluid volume deficit. That's one topic I want you to make sure you study. What will be the effect on your blood pressure? It decreases. What happens to the heart rate? It goes up because you're trying to compensate, like a part of the homeostatic allostatic mechanism. Okay? Now, when can it reach the stage of exhaustion? Stage of exhaustion. When you become severely what? Dehydrated. Okay? Now, I want you to think. Point where the body can no longer return to homeostasis. You have lost, let's say, 2 liters of water in the stool. Now, remember, how much water do you have in your body? Your circulating blood volume, which is plasma, which is water. 6 liters of blood. If you lose 2 liters of water in the stool, will that affect your blood volume? And that's called hypovolemia. And you can develop what kind of shock? Hypovolemic shock. You see? You understand what I'm trying to say? So, we're now in the process of trying to integrate all these things. So, hypovolemic shock is going to kill you. What kind of shock? Hypovolemic shock. Right? So, what will the body do? What will the body try to do to save your life? First, it will release what hormones? There are 2 hormones that are responsible for water retention. What are these 2 hormones? Anybody? ADH and aldosterone. So the ADH is formed where? Where is it formed? The hypothalamus. Oh shit, I'll give you the answer. The ADH, or the antidiuretic hormone, is produced in the hypothalamus. It's stored where? In the posterior lobe of the pituitary gland. Again, it always goes back to anatomy, right? What does it do? Antidiuretic means it will make you retain the water by the kidney. What is the other hormone? Aldosterone. What is that hormone? Otherwise known as what? Mineralocorticoid. What does it do? Water retention, sodium retention, but what? Potassium excretion. Again, make sure you know about that, right? So you want to retain water, but the problem is that you have reached the stage of exhaustion. Even though the body attempts to make you retain the water through ADH and aldosterone, but it is not what? It's not enough. You have reached the point of stage of exhaustion, so what do? The patient is brought to the emergency room, what do? Will I tell the nurse to give what? Fluid replacement. Of course. Should I give it to the mouth or should I give it intravenously? Intravenously. So this is what we're trying to say here. You are in a class like this because you want to know what is being done as part of your nursing intervention. The patient has reached a stage of exhaustion. Even though the body attempts to correct the problem of fluid volume deficit and dehydration, it has its own limitations. That's the reason why we have to intervene. We have to give fluid replacement in the form of IV fluid replacement together with water and electrolyte replacement. Okay? So there are a lot of stressors, physical, chemical, emotional, biological stressors. Be aware of that. And of course we talked about the different risk factors. Make sure you're aware of them too, because you can know how to prevent them. Now, here in this slide are the involvement of many hormones, as we already mentioned. The adrenal medulla involves the catecholamines, which includes your norepinephrine and epinephrine. Anybody tell me another name for epinephrine? Adrenaline. Okay? So, plays an integral role in allostasis, causes tachycardia, diaphoresis, peripheral vasoconstriction, tachypnea, and pupillary dilation. Now, what about the effect of this substance on your airways? Bronchodilate or bronchoconstrict? So if you answer bronchoconstrict, the answer is wrong. It's okay. You can take the nursing exam again. Okay? What does adrenaline do? Bronchodilate. That's the reason why. Remember, I told you to study COPD. What is an example of COPD that causes bronchospasm? Asthma. Will I tell the nurse to give adrenaline or epi? Yes, we do. Because what does epinephrine do? Bronchodilate. Okay? Do you understand? In fact, we given this in the form of an EpiPen intramuscularly. Do you understand? Now, steroids, we talked about this. Glucocorticoid, which is the cortisol, and aldosterone, which is what? The mineralocorticoid. Okay? So make sure you know the effects of these hormones on the body. Okay? And then endorphins. What are endorphins? Natural pain relieving substances. This is the basis for acupuncture, acupressure. Every time they insert the needle there, you have natural occurring opiates or opiumate, substance-like substance. Reduce pain. It's very important. And of course, we talk about cytokines released by the macrophage during a stress response. So again, the effects of other hormones, estrogen, testosterone, on the body, and including growth hormone, prolactin, and oxytocin. Again, as we always emphasize, if you know the functions of this hormone in relation to stress, you know what's going to happen to your patient, right? Prolactins, growth hormone, immune response, and oxytocin. We talked about this before. Labor and what? Milk ejection for milk for the baby. Okay. Although stress exposure initiates integrated responses by multiple systems, the functional changes are first manifested by which system? See this? Stress exposure initiates integrated responses by multiple systems. The functional changes are first manifested by which system? What do you think is the first system that is involved here? The functional changes are first manifested by which system? What have we discussed so far? What are the glands and the structures that we have talked about? We talked about what? When you are very stressed, what involves with stress. We talked about the hypothalamus. We talked about the adrenal gland. Huh? What will the answer? Of course, neuroendocrine. Again, be careful. We're talking about stress response. We talked about exposure to stress. So far, we have talked about what organs? Hypothalamus, pituitary gland. What is that part of? Nervous system. What about the adrenal gland? Is it an endocrine gland? See? So, it's okay. If you answered other letters, it's fine. It's only one mistake. You understand what I mean? But one mistake could make you pass or fail an NCLEX exam. See? Be careful. Okay? Now, a patient is experiencing significant stress while awaiting results of her recent biopsy of a lymph node. Among the hormonal contributors to this response is release of aldosterone. What is the effect of aldosterone on a patient who is under a lot of stress? What's the answer there? A, B, C, and D. Okay, who says A? Who says B? Who says C? And finally, who says D? Okay, only 4 people will pass the exam. The rest are not answering. So, the idea here is that you know that aldosterone will promote water and sodium what? Retention by making the kidney what? Reabsorb the sodium. Okay, so do you know what I'm trying to say here? Questions like this could be asked of you. You know what the hormone does. Aldosterone is secreted by what gland? The adrenal cortex. That's the reason why it's also known as what? Mineralocorticoid. What are the minerals involved here? Sodium and potassium. Sodium absorbed. Water absorbed by the kidney because of the action of aldosterone. What about potassium? Excrete. Which makes sense, right? Therefore, in Cushing's, where the aldosterone levels are high, remember we talked about Cushing's, which is a very important topic, which I told you to study. What happens to the sodium levels? High. You have hypernatremia. What is hypernatremia? High levels of sodium, which is above what? 145. So make sure you memorize also the values. So sodium, potassium, whatever values, calcium. Okay? Now, of course, individual stress responses change with time and circumstances. Effective stress response. There are a lot of factors that could affect this. Genes, culture, all these, right? Again, we have to adapt. Okay? That's something that is very common among us. The biopsychosocial status have changed in response to new or altered circumstances. That's very important. And of course, coping. Behavior or adaptive response to a stressor based on coping mechanisms. Now, these coping mechanisms, you will learn this in mental health, which is a very common topic in the nursing exam. How can we adapt and cope with stress? And of course, the stress is defined as the perceived inability to cope with the stressor, or in some cases the word allostatic overload, inadequate adaptation. Remember the example I gave you? When you have diarrhea, you lose a lot of fluids in the body. How did the body adapt? Release of ADH and what? Aldosterone. The hormones were designed to keep the water retained through the kidney, and that's why you notice how whatever happens to the color of the urine. Why is the urine dark yellow after an episode of diarrhea? Because it's the effect of the ADH and aldosterone. They're trying to make you retain the water, so the amount of water inside the urine will be less. The urine becomes more what? Concentrated, so it's dark yellow. And that is how you understand this thing, right? So pathophysiologic states result affects all areas of the body whenever what? You're not able to what? Re-establish homeostasis. The body's attempt to adapt is not adequate. So there is a list of all, so I want you to know this in terms of effect on the nervous system, integument, eczema, acne, hair loss, nervous state, all these. A lot of people will ask me, Dr. Gamo, if I have to study the slides, do I need to know everything? The answer is yes. If you really want to be the smartest graduate in nursing in the world, every time you have a chance to learn, you learn. A lot of people will just come to me, what will come out in the exam? Of course I can't do that. Because in the nursing NCLEX exam, they will not tell you what will come out in the exam. You're supposed to know. That's why personally, I am not in favor of giving what? A study guide. Because what happens? If I give a study guide, what happens to the students? They will not study the other topics anymore, which is not good. Because when you take the NCLEX exam, any question can be asked. Okay? See? So a lot of this we talked about. Diabetes, hypertension, stroke. What is CAD? Coronary artery disease, right? Okay. Okay, two people experience the same stressor, yet only one is able to cope and adapt adequately, right? An example of the person with increased capacity to adapt is the one with what? A sense of purpose in life, circadian rhythm disruption, age-related rhythm dysfunction, excessive weight gain or loss. A person with increased capacity to adapt. Two people experience the same stressor, yet only one is able to cope and adapt adequately. So remember, the stress could be in the form of mental, physical, or chemical. An example of a person with increased capacity to adapt is the one with a sense of purpose in life, circadian rhythm disruption, age-related renal dysfunction, excessive weight gain or loss. What do you notice? Everything is what? Negative. Negative. The only one is what? With a sense of purpose in life, right? So this is an example of a emotional what? Stress or mental stress, which many of us are exposed to, right? So we have a lot of coping mechanisms. Like example, I'll give you an example. This is just a psychology, a psychiatric example. When you do not do well in an exam, what do you say? Oh, the reason why I failed because I did not study. Last night I was doing something else. And you feel good. Why? Because you're trying to justify why you did not perform well. Or sometimes what do students do? Oh, I did not pass the exam. Oh, it's the fault of the teacher. So what are they trying to do? They're not blaming themselves, they're putting the blame on somebody else. Will that make them feel better? Maybe because they came up with a reason, but it's not the solution to the problem, right? The reason why you did not do well because you did not study well. You understand what I'm saying? Okay. Is it clear? Okay. I think we could end there.